And yeah, thank you all again so much for being here. It's virtual this year, but we are just so happy that you are here with us today. And we would like to introduce our amazing speaker, Dr. Schueller, for their workshop, Digital Tools to Promote College Student Mental Health.
Fantastic. Well, thank you for the opportunity to speak. I appreciate ASUCI for putting on this meeting, as well as for the invitation to talk a little bit about some of the work that I do and try to think about how digital tools might be able to promote the mental health of college students. So just as a little bit of introduction for myself, that's me. Next to Spider-Man, I'm not Spider-Man, but I do wear a lot of different hats. So I'm a faculty here at UCI in the departments of psychological science and informatics. I'm a clinical psychologist by my training, but my work sort of spans clinical psychology and technology, which is why I'm in both of those two departments. I also serve as the executive director of One Mind Cyber Guide, which is a nonprofit project that seeks to empower consumers to make informed decisions about digital mental health products that I'll speak a little bit about in this presentation. I do a lot of research in the area of digital mental health. I also serve as on the evaluation team here at UCI for a statewide project here in California where the state is rolling out digital mental health products and county mental health services to try to learn more about how these tools might be able to be useful for folks. And so through that project, I've really got to learn a lot about what California is doing and how California is thinking about trying to use these tools to help. I want to start with a couple learning objectives for this workshop and what I hope at the end of this workshop that you all get out of this. And so if you don't get one of these three things, feel free to add some questions and hopefully I can address it a little bit more in the questions. But first I want to just help people understand some of the different aspects that are used to evaluate mental health apps. Second, I want to help familiarize everyone with some specific apps and tools which might be especially useful for college students. And then lastly, I want to engage in a conversation around healthier phone use and how we can use technology generally to enhance rather than consume our lives. And that was definitely a question I got from someone prior to this workshop. Someone sent along a question to ask, can we talk more about how phones generally are sort of impacting our mental health and what we can do about that? And so we'll try to talk a little bit about that as well. First, with just a little bit of context, and probably not surprising for folks who are attending this workshop and who are interested in this topic, but there has been an increase in mental health symptoms and mental health issues among college students over the past couple of years. This is data that comes from the Healthy Minds Network, which is a national survey of college students that multiple colleges participate in. And this would be true if we looked at sort of any metrics, but I just pulled out one, which is depressive symptoms. And you can see over the past couple of years that the number of students who've been reporting severe levels of depressive symptoms, this is a patient health questionnaire score greater than a 15. And just as a little bit of an indicator, we would usually refer people to treatment at a PHQ-9 greater or equal to 10. So these are people with pretty significant depressive symptoms. You can see that over the past, and this is even prior to the pandemic when we know mental health symptoms have gone up, we see that just under 20% of students are reporting these kind of severe levels of depressive symptoms. And you can see that since between even fall 2019 to fall 2020, we saw increases in depression both at the severe and moderate level. So this is there's a need among college students for more mental health resources. We also see mental health is not just diagnosable mental health conditions. Mental health means, all of us, all of our functioning and how we're doing. And similarly, if we look at sort of not just clinical diagnosis or, clinical levels of depressive symptoms, we see increases across other sort of mental health challenges. So college students are reporting feeling more likely feeling lonely, lacking companionship, feeling left out, and feeling isolated from other people. And I know it might be a little bit strange to think about, that technology might be able to overcome some of this loneliness, but I do think that there's ways in which technology, if done appropriately, can actually help us connect with other people rather than keep us apart. So I think all of that is sort of framing that, given the huge need for mental health resources, I think we need to think about expanding the portfolio of tools that are available. I don't think that technology should be a replacement for traditional resources, but we need more tools available in our toolbox, and it can't just be professional services or the counseling center alone. So enter mental health apps. What do mental health apps do? There are a variety of different mental health apps out there. I'll talk more about this in a second. But generally, I think about mental health apps as being able to do sort of like three different things. It can help you track aspects of your own mental health or triggers, medication, different things related to your mental health. On the left-hand side of the screen, I have an image from an app called Mood Path, which is a mood tracking app. And tracking tends to be one of the primary reasons that people go to these apps. They want to learn more about themselves. They want to gain some insights. These apps can also be psychoeducational. They can provide us some information about different mental health challenges or mental health treatments or resources or tools that might help us cope with our mental health. This is an app in the middle, an app called Senvello, which is based off of cognitive behavioral therapy. And then lastly, apps can have some interactive tools to be able to teach us some of the skills that one might learn in therapy to be able to apply to their lives. And here on the right-hand side of the screen, I have an app called Youper, which is a chatbot app that allows users to be able to chat with this technology to be able to learn some skills. I'll also say chatbot apps are really popular among especially sort of youth and college student populations, because it really helps you kind of have this sort of interactive app that people tend to like. So what do mental health apps not do? Mental health apps are not a replacement for traditional treatment. They are not replacements for therapists. Instead, I think that they can be used in a variety of different ways with relation to traditional services. They can be an introduction into therapy skills, so that when you're on a waiting list or you're waiting or trying to find a professional service that's appropriate for you, you can use a mental health app to start to learn a little bit more about what that treatment might be like. You can also use them in conjunction with therapy. And many studies show that mental health apps can make therapy more effective and more efficient. You can get through it faster sometimes if some of what you would be doing with that therapist is being offset to the mental health app. And then lastly, they can also be used after you go through a course of traditional treatment or after you receive some professional services to reinforce or to further practice some of the skills that you pick up in those treatments. And so I think that, we can think about these tools as a continuum of care, but really I want to frame that, these tools are not meant to be replacements for therapists. I'm a licensed clinical psychologist myself. We're starting up a clinical psychology PhD program at UCI. I very much believe in the training of therapists, but I think, as I said, there's so much need that we need a portfolio of resources, and these digital tools can fit into that portfolio. So mental health apps, there are a lot of them. In fact, there's estimates that about 300,000 health apps exist, and about 10 to 15,000 of those are targeted specifically towards mental health. Of those 10 to 15,000 apps, many of them have no evidence supporting them whatsoever. In fact, most research studies show that about 3 to 5% of these mental health apps are evidence-based, which means that most of these products are potentially ineffective at best and harmful at worst. And I say that makes finding a good app then like finding a needle in a haystack. That doesn't mean that there aren't effective tools out there. Even 3 to 5% of 10 to 15,000 means that there's 100 plus tools that might be effective and based on science-backed solutions. But then there's still thousands of apps out there that aren't. And so it's really hard to separate the good from the bad. So enter the work that we do at One Mind Cyber Guide. As I mentioned, One Mind Cyber Guide is a project where we try to empower consumers to make informed decisions about mental health apps. We identify these products and we review them on a couple different dimensions that I'll talk about in a second, and then disseminate that information to consumers to help them make informed decisions. And you can actually go online at onemindcyberguide.org and see all of the reviews and all of the content that we've done here. So how do we evaluate these apps? And again, this is a learning objective that I think is really important to get out of there, because there's no one size fits all solution. There's no one app that's going to be useful for everyone. And there's no one criteria we can use to determine like what app is most useful. There's no one app that's the best app and everyone should use it. Instead, we think about trying to understand apps in 3 different areas. The first is credibility. How likely is it that this app will work for me? How much evidence is there supporting this app? And does the app have sort of the right sort of team behind that app to develop a clinical app? Or is the app being updated regularly? We look at user experience. How likely is it they'll actually use this app? Is it fun and engaging? Is it easy to use and easy to learn? Is it free from technical glitches? And then we look at transparency around the data security and privacy policies. And we say transparency rather than data security and privacy itself, because we don't conduct a technical audit of the app. Instead, we review the data security and privacy policies to determine what happens to my data if I enter it into this app. Where does it go? Do they keep it safe? Do they sell it to other people? And one thing that's noteworthy is a lot of these products don't actually even have data security and privacy policies. We did a study a couple years ago now at this point where we reviewed about 120 different depression apps, and we found only about half of those had data security and privacy policies themselves. So using this transparency bar and understanding the data security and privacy policies is a really useful way to sort of understand these products. We also conduct what we call professional reviews, which is where we have an external member to our team write a review about how to use some of these products in your life. What is it based on? A lot of these apps don't come with user guides. They don't tell you exactly like how it might be useful for you or some tips about how some other people have used it effectively. And so we have experts come in and review these products and write like a narrative review. People who practice in different areas tell you, how this might align with some of the things that they do when they're providing treatment and how you can get the most out of this app. And so it's really useful if you're looking to use an app to go to some of those professional reviews to get some extra tips. And in fact, on the onemindcyberguide.org website, these professional reviews are some of our most popular content, especially for some of the apps that are the most frequently used, apps like Headspace or Calm. And so we have a lot of content to help people to understand how to use those popular apps, many of which you might have heard about. So why is it important, especially to review apps for college students and to better understand how these digital tools might be useful for college students? I think sort of two recent studies really indicate the need here. The first is a study done by John Toros and his group that reviewed the websites of college counseling centers, and they found that of those college counseling center websites that they reviewed, there were about 218 different apps that were recommended. This is a lot better than the 10 to 15,000 that are out there. So I think, that's progress in terms of trying to reduce or narrow the amount of products a little bit. But unfortunately, when you looked at those college counseling center websites, about a third of the apps were no longer available, and only 16% of those apps had direct empirical support, which means only about 16% of those were science-backed solutions. So again, this is a really hard field to make sense of. It's a really hard field to navigate. And even counseling centers, which are well-intentioned and trying to help students, often have a hard time of trying to find, what are the really effective products and what are the things that have evidence supporting them. Our team, led by Judith Borjos, recently did a survey of 500 community college students to better understand, who was using mental health apps, what did they want from the app, what were sort of clear criteria that would make them want to use or not want to use an app. And in that group, we found of those 500 students, about 1/5 or 21% of them had previously used a mental health app. Some of the things that were most important to students was having an app that was free. So something that is, low cost or no cost. Making sure that the personal information will be kept private. So data security and privacy was a huge interest. And they wanted apps, if we look at the common features, things that help them work through negative emotions and thoughts, be able to identify or recognize symptoms, being able to track their symptoms. So again, these sort of educational and didactic, educational and interactive tools that I kind of mentioned that are present in a lot of these applications. At OneMind CyberGuide, we've actually developed some different toolkits that specifically focus on identifying some apps that fit into some different categories that might be interesting to college students. This is one that we've developed that's available on our website called Self-Care as Wellness. You can see some examples of some different apps, some that are focused on managing the moment. Mend, for example, is an app that helps people get through relationship breakups. Finding your focus, so different mindfulness apps that are present. Insight Timer is a nice app because it has a lot of free content available in it. Game Your Goals, which kind of use gamification to be able to help people keep on track. And I'll talk more about Super Better in a second. But just a variety of different apps that meet different concerns that are very common to college students. And so I think that that's one thing that's really useful when you're trying to understand this space, is trying to find products that meet the needs that you have. So here's two specific apps that I think are really applicable for college students. One is called Nod, which was an app that was developed by Hope Lab and Grit Digital Health. And in fact, this was an app that was designed specifically for college students. And they actually did a randomized control study, or which is a scientific study to understand if this app helps. And they found among a group of 221 college students, Nod actually helped buffer against loneliness among those experiencing higher levels of depressive symptoms. So that means that this app is really designed to help people engage in sort of social problem solving and overcome, get to meet people through giving them social challenges. It's a really cool app, and so it's one I recommend. And another one is Super Better, which helps you kind of come up with a goal that you're focusing on and helps you kind of set strategies to achieve that goal through creating these kind of gamified experience. And in fact, again, among a group of 283 adults, Super Better helped decrease depressive symptoms. And so it finds that not only does it help people achieve their goals, but it also helps benefit people's mental health. So I'm going to shift gears to just close out this talk to talk a little bit about this question of, well, Dr. Schueller, I hear that smartphones and technology is like really leading to a lot of these mental health challenges. And sometimes I feel more stressed than relaxed when I use my phone. What do you think about that? And I'll say that, if you listen to the media, you hear this a lot. This is just a couple snippets of different media headlines that I didn't take a long time to find. But 12 ways your smartphone is making your life worse. 5 reasons your cell phones are bad for your health. The negative effect that your cell phone is having on your life. And so I definitely think there's a lot of narrative in the media about this. But I think importantly, what we see if we look at research is that on average, smartphones are having small impacts on the mental health of youth. That on average, most people are not having sort of strong impacts of smartphones. Now, we do find that some people benefit and some people experience negative effects. And so I think that a lot of what we need to think about is not, on average, or are smartphones leading to all these mental health problems, but how do we help mitigate some of the concerns or some of the challenges of smartphones on people's mental health? And how do we help enhance some of the benefits? So put that another way, how can we use our phones to enhance and not consume our lives? I think sort of 2 tips I'll give real fast before I wrap up this talk. One is that, trying to make sure that you moderate your smartphone use, I think, is really critical. And there's some apps that are even helpful to be able to do that. If you have an Android device, for example, the Moment Screen Tracker app is, I think, a good one. On the iPhone, there's also a lot of screen time tools that are built into the phone itself. Finding, giving yourself sort of dedicated times to use your phone. So having like a social media time every day rather than, just always going and using it. Or trying to make sure that you don't go over certain allocations, I think is one thing that's really useful. Taking social media breaks is completely okay. Another thing to think about in terms of how you use social media. And we find that, trying to think about those people who are helped or harmed by social media, the people who get the most benefit of social media use it in slightly different ways. They're using social media to find times to connect with their friends rather than people they don't know that well. They're sharing updates from their own life in a very sort of appropriate or positive way. I think another thing that I always say is, really try not to focus too much on social media in terms of what everyone else is doing. I always say, everyone looks good on the highlight reel, and social media in a lot of ways is everyone's highlight reels. And so if you try to compare yourself to a highlight reel, if you compare every aspect to your life to only the best parts of other people's life, that's going to be a really, really challenging situation. This is just, this comes from a report recently that shows exactly what I mentioned, that they surveyed a nationally representative sample of youth 14 to 22. And they found that, about 30% of those youth said that social media actually helped benefit their mental health when they were feeling anxious, depressed, or stressed. 22% said they made it feel worse, and 47% said it had neither impact. It was neither better nor worse. So again, this shows that, on average, social media is having a small impact on mental health for most people. Some people get helped. In fact, more people than get harmed, but there is some opportunity or some different things that we have to understand how to mitigate those negative experiences of social media. There's also a lot of really nice resources out there, though, for mental health on social media. One that I'd call out is the Mental Health Coalition, which was organized by Kenneth Cole. I did a Instagram live event for this group earlier this week with Griffin Johnson and Josh Richards. It was really great. Griffin and Josh were talking about their own experiences with mental health and with social media and how they mitigated some of that. And so I think that what I also want to sort of indicate is that when we talk to kids and we talk to students who are using social media in ways to help improve their mental health, they're often curating their social media. They're finding some of these useful resources, these useful things, positive images, things that kind of help put them in a positive mindset in ways to make sure that the social media is helping rather than harming. So a couple just closing sort of points. There are lots of apps out there. Some could be helpful, but most likely not. And so you do have to find some resources like One Mind Cyber Guides to help sort of sort out the good from the bad. No one app is going to help everybody. So even if you find an app on One Mind Cyber Guide, or if a colleague or friend recommends an app for you and it doesn't work for you, don't think that you're hopeless. Don't think that nothing's going to help you. It just may not be the right app for you. Apps are not a replacement for people. Friends, family, therapists, these are important resources in mental health services. And apps can extend or enhance these support options, but not replace them. And then lastly, mental health apps are part of a broader technology ecosystem. And so how you use your phone generally can also impact your mental health for good and for bad. And that's it. I think I have about 5 minutes for questions here. Feel free to drop any in the chat. You can either DM Jenny if you want to, or if you want to raise your hand, I can also look at folks raising their hand. I see a question here. Why are these apps marketed towards college students and not other populations? So I will say there are a lot of apps that are marketed towards other populations. I was specifically in this talk talking about products that were sort of more oriented to college students, given the theme of this meeting. But there are apps marketed to a lot of other populations. For example, the Department of Defense and the Connected Health Alliance have actually developed quite a few of really great apps that are targeted mostly for veterans, although I think a lot of them are sort of useful for broader populations as well. One of their newer and one of my favorite apps is an app called COVID Coach that helps provide some skills and resources for coping with stress, anxiety, and depression in light of the COVID pandemic, and also has a lot of good resources to find some helpful support in light of COVID. So I think that they are being marketed towards a lot of populations. I think that college students are one that's sort of an interesting group to try to provide some support with these tools for a couple reasons. College students tend to be pretty technologically savvy. Every college student has an email address, and so it's able to reach people through technology. They also often have good access to technology, broadband, and other things that might make it harder to reach other populations. And they also get sort of support or resources through the university or college campus. And so there's a clear gateway and door to be able to reach people. So I think those are a couple reasons on why the college student population is one where these tools can be particularly impactful, but I think that the need and the use of these tools exist outside of college students as well. Any other questions? Let me check and see if people are raising their hand. Why do I think there are so many apps that don't work or potentially be harmful? I think one of the big challenges is there's not a lot of regulation in this area. The FDA approves some products that are in the sort of category of software as medical devices. And the FDA cleared their first product in the mental health space in 2017. It was an app called Reset by Pear Therapeutics, which is an app that's focused on helping support substance use disorder. Since Reset's been approved, though, there's only been 5 apps that have been cleared by the FDA. Reset, Reset-O, Somrest, Nightwear, and EndeavorRx. So 2 apps for substance use, 1 for ADHD, 1 for insomnia, and 1 for post-traumatic stress disorder. And so there's just so little regulation that's going on in this space. And the app stores, don't review these products to determine if they're effective or not. So I think that there's just a real need for more regulation and more resources to help people sort this through. And I think that that's something I'm very interested in. Could I comment a bit about mindfulness apps like Headspace? So mindfulness apps are by and far the most popular types of products in this space. So if you look at the number of downloads and the number of users, 90% of people who are using mental health apps are using a mindfulness app, especially Headspace and Calm. Those are the by and far the two most popular. I think they're really great. I think they have some really useful resources, and there is some research to support that they can be helpful for things like wellness and for reducing stress and promoting happiness and well-being. Whether or not they can be useful and effective at for sort of diagnosable mental health conditions like depression, anxiety, I think is an open question, which we don't know yet. I think, some people think that Headspace and Calm, they can be expensive. They do have monthly service charges. If you have Netflix, Headspace actually just released a really cool, they have Guide to Meditation and Headspace's Guide to Sleep. And so you can get those resources off Netflix as well, which is something that I think a lot of people have access to, so might be a good way to get those resources. There's a couple more questions here, but unfortunately we're at the sort of end of our time. So I actually just wanted to share, my contact information. I'm always happy to chat with folks. I also lead the Technology and Mental Health Lab here at UCI. My Twitter, our website address at One Mind Cyber Guide, and you can also follow Cyber Guide on social media. Oh, it sounds like actually I can answer a couple more questions. So let me see. Sometimes certain apps can take a lot of tech savviness and discourage users, especially if they're not helpful guides. How can we pass the hurdle, especially in time where everything is virtual? I think that that's really a great question. That's something we find a lot in my research and my work, is that digital literacy is a very large impediment to using these tools. But what we find is often if we teach people some digital literacy skills, if we teach people how to better use apps and use their phones, that some of those folks are actually the sort of biggest consumers. We've done this in some research I've done with some colleagues where we've worked with Latinos and Latinas with limited English proficiency. So people who are predominantly Spanish speakers and have low tech literacy. And we give them a little bit of a training, like, here's how you use your phone, here's how you use text messaging, here's how you download an app. And then we give them some different tools, and we find that these are some folks who are, really interested and eager then to use those products. And so I do think that we have to, we can't assume that everyone's ready to use a technology and ready to use an app. And actually, that was one thing through my One Mind Cyber Guide project. We did a sort of a refresh of our website about a year and a half ago. And one of the big sort of insights we did on that during that refresh was providing a lot more resources around helping people better learn, like, well, what are apps and how can they be helpful and how can I evaluate them, rather than saying like, oh, cool, you're here at this website, you're ready to use an app. So I think that it's a really great point. And I do think that we need to provide better tools and resources. And I'll say in that California project I mentioned, Help at Hand, that's also been a big learning, especially in light of the pandemic, is teaching people how to better use technology, even stuff like Zoom. Like we were chatting a little bit about this before the session started. Zoom always has technical problems. It's always hard to get people on and figure out all the issues. And during the past year, most people have been using some sort of telehealth platform to be able to get even traditional therapy. And so that's been a major barrier to providing resources to people in need, is just tech literacy. So I think training that is really important and really critical. Let me see what next question we have. What do I think about time management apps? I think that time management apps can be really helpful for certain people. Again, like there's no one size fits all solution. I think with time management apps, there's usually two ways that these get talked about. One is that apps that help people manage their time for tasks that they're doing. And I think that, in addition to the work I do through One Mind Cyber Guide and all the stuff I do on the tech side, I also lead a wellness initiative in the School of Social Ecology called WISE, the Wellness Initiative in Social Ecology. And talking to students, time management is a skill that I think a lot of people struggle with, especially during the pandemic. I think it's been hard because things have shifted to be more asynchronous and remote, which is great for flexibility, but not so great if you're a person who really benefits from a lot of structure. So I think having tools to better promote sort of time management is really, really helpful. There's something that we teach sometimes in time management and therapy, which is the Pomodoro technique, which is, you do something for 30 minutes and then you take a 5-minute break. And really kind of scheduling that out, I think, is really helpful for some people who get distracted sometimes, or have a hard time finishing through on certain tasks. But also it helps people who fall into the trap that I think we all fall into sometimes, is I just have to sit down at my computer and work really hard for like a couple hours and I'll get all this stuff done. Like, giving yourself dedicated times to take breaks and to step away, and to figure out what you're doing during that break time, so you're not just surfing your social media and then you look up and it's like 2 hours later and you're like, oh shoot, I was supposed to finish that paper. I think is really critical and useful. So I think time management apps can be really helpful to serve that goal. And as I mentioned, time management techniques are things we've been using in therapy for years, and so to be able to kind of again bring that into the digital world, I think can be really helpful. Other questions? Yeah, I just want to comment. I see a comment on some of the challenges with the Latina community around sort of virtual spaces and using Zoom for mental health education. And I think another thing that's really an unfortunate aspect in the space currently is, although a lot of the reason people are interested in digital tools is the promise of building sort of scalable resources. They're going to be able to provide, resources to people who traditionally have not gotten them. If you go to the One Mind Cyber Guide website, for example, and search for, give me an app that's available in Spanish, there aren't a lot of them that are out there. And so I think that there's a big missed opportunity to be able to reach, various communities in these tools. And again, this is something we've seen in this California project, is that there was a lot of interest because of the desire to be able to scale mental health services to some of the threshold languages that we have here in California. And again, I think it's been sort of a missed opportunity. Spanish, as I mentioned, there's not a lot of tools, but there's a couple of them. But if you go outside of English and Spanish, the availability in other languages drops pretty considerably. I know Headspace and Calm, one of them has resources in Chinese and the other has resources in Korean. I forget which one it is, but it just shows you that outside of English especially, but secondly Spanish, having sort of broadly available digital tools is an unmet need currently. And then on top of it, there's all sort of the cultural concerns and the issues that have to come up in terms of trying to think about, are these tools sort of culturally appropriate? The tool might be available in Spanish or another language, but some of the pictures or the images, may not represent, Latinas, Latinos, individuals from different cultural backgrounds and ethnic and racial backgrounds. And so I think that it's something that needs to really get done in this space. Do you have any recommendations on how to provide some digital literacy to Latinx populations in OC in order to get them more involved in mental health resources? I mean, that's I think that really grassroots efforts to be able to, provide some digital literacy training, I think is really key. Teaming with different community organizations, and then finding some resources that are available. And there is, I'll actually stop sharing my screen for a second here to try to find the link to this. But as I mentioned through this California project, there are some different digital literacy stuff that's available. Let me see if I can find this real fast and drop it in the chat. My Googling skills are not finding it right now. If you email me at the email I provided, I'll be able to find them. I just am not getting them in the moment here. But I do know that there's, on the Help at Hand website, there are some digital literacy trainings. Also at Beth Israel Deaconess Medical Center, they have a digital psychiatry program that does a lot of digital literacy training. It's actually the program that the Help at Hand project based their digital literacy on, was on this project. So I do think that there are some resources out there to help provide some basic digital literacy training. I think another thing to just note with the digital literacy piece is that I find it's a very nuanced thing, because I think, what I found working with different populations is that the needs, for any community is probably a little bit different from what the generalized resources are. And so I think like really getting to know the community or the place you're trying to provide that training or those resources in, and figure out a little bit more what they need is a useful way to help address it. Well, thanks again, everyone, for attending this session and for the conference in general. I really appreciate people's desire to learn more about mental health and different resources that are available, but also just helping sort of think about different ways to create more of a dialogue around this topic that traditionally has often not gotten talked about in a lot of different places.
I just want to say thank you, Dr. Schueller, for such an informative presentation. And if there's no more questions, we'll be wrapping up right now. And yeah.
Thanks a lot. See you guys.
Yeah, thank you everyone for coming.